Honorable Vice Chancellor and respected panelists, Dr. Subhrojyoti, Bhowmik and Professor Dr Chakraborty, and of course all the viewers. Today we are here with a very, very important topic, that is vaccination. Many people have different notions, and maybe sometimes people have wrong notions also regarding vaccination. Now you have an expert in in vaccination, Dr. Subhrojyoti Bhowmik, and Professor Dr Chakraborty, renowned physician. He is also present here, and our Honorable Vice Chancellor is there. Because of his inspiration, we are actually continuing this kind of programs, and in future also you may expect some more. And today I will request for this program to Professor Dr. Shrikot Moitro, Professor, our Honorable Vice Chancellor, to say the inaugural words. Sir, please.
Thank you, Dr. Dasgupta. So today we are going to have a presentation from Dr. Subhrojyoti Bhowmik regarding the importance of vaccination. What I observed personally, that still there are lots of these confusions and questions among the mind of even many so-called educated people, and some of these perceptions, apprehensions, confusion still existing regarding the efficacy of this vaccination system. And I came across the ideas pitched by many these persons from medical fraternity also. They are still suspicious about this effectiveness of the vaccination process, with this with the argument that this virus is continuously changing its nature and all these things. There are lots of myths, speculations, self-conceived ideas, and all these things are still this running amok in the entire social world and all this social media, and people are, as we are today, we are literally plunged in this plethora of information. So whatever quality of information are coming, we are absorbing it, and sometimes it is entirely changing our perception and our level of confidence at the same time. So we need to have some deliberations on the truth behind all these things, and for that purpose, this program is being organized. Dr. Subhrojyoti Bhowmik will present this reality of all these things, behind all these things, from his personal experiences, from the knowledge resources developed by researchers in this particular period regarding regarding the vaccination process, nature of virus, all these things. It was being said, I came across this idea that the vaccine, this virus initially targeted old people. At the second phase, it is targeting middle-aged people, and later stage it will be targeting young people. Whether this is always true, and whether this vaccination process it will be making the entire nation shape, entire world shape. So all these things will be deliberated by Dr. Subhrojyoti Bhowmik. We have Professor Dr Chakraborty also to put forward his views to make these things more validated, more lively, and we expect lots of interaction from our participants. You can always post your queries. You can place your these doubts, confusions to get it clarified. And we need to have all these things being a part of the scientific community. We need to relook, and we need to deliberate each and everything in a very, very logical and scientific way. So with this, I'm very glad that Dr. Subhrojyoti from our university, and probably it is a program of our digital cell, initiative of the digital cell of this university. So we have organized these programs, and Dr. Bhowmik, Dr. Chakraborty, and you agreed to be a part of it. So I am expecting, these are very lively, truthful, and this factual deliberation from Dr. Subhrojyoti Bhowmik to remove all these myths and all these speculations and all these fiction associated, all the fictitious parts associated with this vaccination process. So over to Dr. Dasgupta for continuation of this session. Thank you.
Thank you, sir, for our encouraging and inspirational words. And now, before going to Dr. Subhrojyoti Bhowmik, we will want to see, hear from Professor Pranto Chakraborty a few words regarding this program today. Sir, Professor Pranto Chakraborty, kindly.
Yeah. Good morning, everybody. And as Honorable VC has pointed out, that parallel to the pandemic, we are having an infodemic. And that infodemic is being fueled by the social media and half truths. So instead of looking at it in a transparent manner, we are actually putting whatever ideas come to our mind without any validation into the minds of others. So to combat this infodemic, a term which has been coined by World Health Organization, we are trying to get the truth to the people, and people should realize that science is ever changing. So science has no problems in accepting that there are challenges, and our duty is to convert these challenges into opportunities and to try the improve the health of the human race as a whole, and try to take everyone together. Also try to create an equitable health distribution even in terms of vaccination. So it's my proud privilege that Subhrojyoti, a brilliant junior of mine, you'd be presenting it, and we would be having a good discussion on it. It's good to see almost 500 people have joined in. So I'll not stand in between Subhrojyoti and yourselves. Over to you, Dr. Dashgupta.
Thank you, sir. Thank you very much for, I think, describing the today's perspective of today's program. And before now, let me introduce. Also, he needs no introduction. Dr. Subhrojyoti Bhowmik. He is the clinical director of Peerless Hospital, as well as advisor of our Digital Health Center for Digital Health Technologies in Macau. And he has been he is the principal investigator of Sputnik vaccine trial and in the Eastern India, and he has working experience in Stanford University in medical research and many other universities in abroad. And he is very much, I think, conversant and participant also, rather implementing, I think, the expert also for accreditation of board of hospitals and that's and healthcare providers. And regarding vaccine, I think he has got, tremendous experience, and he can today give us a total picture of the vaccination which is happening and which is going to happen. So that it is our, fortunate privilege that we are going to have a discussion, a deliberation from Professor Dr. Subhrojyoti Bhowmik. And now I hand it over to Dr. Subhrojyoti Bhowmik to have his deliberations. Please, Dr. Bhowmik, please.
Thank you, Professor Dashgupta. Am I audible?
Yes, please. Yes.
Yes, sir.
Okay. Yes. And are my slides visible, sir?
Slides
No,
are
sir.
not
Please
yet
reshare
visible.
it, sir. Sir, please reshare it, sir.
Reshare it. Okay. I'm resharing it. Okay. Just pull my slides. Are my slides visible now?
Not yet.
Visible, sir?
No, not yet.
No, sir.
Not yet. Okay.
I think, is there any bandwidth problem?
I am just trying to see, sir. Just.
Yeah, it is
Yes, sir.
visible.
Yes, it is visible.
Okay. Good morning, everyone. And at first, thank you very much for this opportunity. Honorable Vice Chancellor, sir, Professor Moitro, I think you have been a leader and you have really inspired us to do these kind of programs at the university. And I think I'm very privileged to be part of the digital health cell under your leadership. And thank you once again for allowing me to kind of share my limited knowledge, information, whatever we could gather about COVID-19 disease and vaccine, about the facts and myths. And today, I also want to thank Professor Shivamaya Dashgupta, who has very, very patiently kind of worked on this particular program and helped me develop this program. So thank you, sir, as well. I also want to, it's a privilege for me to present in front of my own teacher, Professor Pranto Chakraborty. Sir, I look up to you, and we would definitely, I know during the course of discussion, would definitely seek your expert opinion as well. So ladies and gentlemen, thank you very much for taking out time on a Sunday morning to discuss this. And though my initial topic was on vaccine, I will try to talk on COVID-19 vaccine, but I will also try to talk something about the disease, because our experience with the disease is changing. As Professor Pranto Chakraborty said, that science is ever changing. That is a constant in science and in life. And a lot of things have changed in COVID-19 disease since it was discovered in November 19 in China. So a lot of things have changed, and we are going to discuss that, facts and myths. Let me begin with the disclaimer that all views expressed are personal and none of my employer or any of the organization. And we all know this, but as a courtesy, I would also like to, as a beginning, I would like to speak on what is this coronavirus. So the coronavirus, there have been many, as Professor Chakraborty was mentioning, that infodemic, absolutely true. I have got WhatsApp messages that coronavirus is not a virus, it is a bacteria. Ladies and gentlemen, it is not a bacteria, it is a virus, and they have been there for ages. They are a large group of viruses which have been causing illnesses in human and animals, and they have been causing illnesses in the animals more commonly. And there have been outbreaks of coronavirus before as well. The Middle East respiratory syndrome in the 2000s, and the serious adult respiratory syndrome in the late 2000s. So there have been, these diseases have been controlled by the countries, and it did not lead to pandemic. But the relatively new virus discovered in 2019 in the Wuhan province of China, which could not be controlled by the countries and has resulted in the pandemic where every continent has been involved, every country has been involved. It's a highly contagious virus, we all know it. And when I see now more than 600 people who are attending this particular webinar, I'm sure each one of you they have a story to tell about this virus, because some of your loved ones, it could be you as well, who has been infected or affected by these virus. And in just few months, I would say just 36 months, we have seen the less than 36 months, we have seen the wreath of the virus, which has infected millions of people and killed millions as well. Now, the most important thing is, once you detect to be a corona positive person, you play a very important role at the society level, and you have to isolate yourself. There are many, many myths where people say that my fever has come down, I am feeling well. After 2 days, 3 days of therapy, can I go out of the house? The answer is no, you cannot go out of the house, because you have to maintain isolation for at least 10 days now, which has been recommended by the Ministry of Health and Family Welfare. I would again recommend you that you must either consult a doctor or refer to the Department of Health and Family Welfare at West Bengal or at the central level to get your queries cleared. And this is extremely important, because as we were talking about science changing, 17 days initially the isolation period. Now the government of India has reduced it to 10 days. So there are patients of mine who are asking, I have been in isolation for 20 days, 21 days. Do I need to go out? Answer is yes, because currently it is 10 days for mild disease, of which the 3 days you should not have fever. This is extremely important, because if you're going out when your symptoms have died out, then you are spreading the disease, you are affecting the community. Please don't do it. We all know this, but this is I would say we want to reiterate on this point. It spreads from droplets when a person coughs, when a person sneezes. We should try and avoid, touching our mouths, nose and eyes. And that is the result. The mask has to be worn. One of the reasons why the mask has to be worn is to protect others infect you. The other reason is to protect yourself infecting yourself. There is a study done in the United States which shows that on an average, a person touches the face, that is his or her face, for 2,000 times. So there are 2,000 times chances of infecting yourself if you don't wear a proper mask. and especially when you are outside the house. So it is very, very important that whenever you are going out, wear proper mask and wear it covering your nose and mouth. And this has to be of the good quality material, because many of the people are asymptomatic. We are in lockdown now, but the unlock mechanism will begin. And possibly after June 15, we will see our state opening up again and we will be back to our normal lives. But if we don't follow these procedures, then we will be unfortunately seeing the surge of cases once again. There's a lot of debate whether the virus spreads through the stool or not, but then this is under, some of the countries believe it, but WHO has not still approved this method of transmission from an infected person. Please remember, 85% of the people who will develop the disease might remain asymptomatic. So till a majority population of the country, which is close to 80% of our population, remember we are 130 crore people, that is official figure. So at least 80% of these people are not infected. We are not going to get the herd immunity. I'm going to spend some time before I jump into the vast ocean on vaccine, on medical masks. The, the currently the government is very, very clear, and the WHO's guidelines are very clear that in case of severe surge, when we saw the second surge happening in these cases, it is extremely important to wear medical mask. I see lot of people who are wearing different kinds of fancy masks, Gucci masks, all those masks which are not recommended, and these are not medical masks. It is extremely important to understand that proper mask will save you. And the mask, if they are single-use masks, say for example, the mask, the surgical, the triple layer surgical mask, if they are single layer, if they are single-use mask, please don't reuse it. I have seen people that they are washing those kind of masks and they are putting them to drying and they're again using it. Please remember, if you do that, that mask has lost the protective action. N95 mask, if you're wearing it, wear it with proper guidance. And the reuse policy of N95 mask is clearly defined that we have to, and if you are in confusion, please get in touch with your doctors, because constantly wearing the same N95 mask has now been also linked to certain fungal diseases. So allow the mask to dry. This is hot, humid weather. Please allow the mask to dry properly. Best thing is to put it in a polythene paper, in a polythene in a polythene mask paper and put it for drying. It is very, very important that you also wash your hands once you are removing your mask, because this is known as getting, while you are doffing off, you're removing the infect, when you're removing the infected mask, remember the outer portion of the mask is very, very infected. It has got all the microorganisms. If you put this, if you touch that and if you don't wash your hands, you can get infected. So who are more susceptible to get COVID-19? And this we know that the susceptibility increases with age, but the susceptibility increases if you have conditions which can reduce your immunity. Cancer patients, HIV patients, chronic kidney disease, lung disease, dementia, diabetes patients, patients who have got heart conditions, and children and young adults. So I would definitely say that there is a very common question which is asked to me that, sir, somebody has got a chronic kidney disease, is requiring dialysis. Somebody has got COPD, do they require the vaccine? The answer is yes, because if you really look at this data, the people who will suffer from the outcome of severe illness of COVID-19 are these patients. So if you have any of these group of patients in your family, don't be in two minds that whether they need to be vaccinated with COVID-19 vaccine or not. The answer is very clear cut that they have to be vaccinated. There cannot be any confusion now. We cannot be in a state of confusion, because the vaccines which have been produced, which are being used in the country, have been given to more than 22 crore Indians. And there are adverse events happening, but I would say the risk of these adverse events is much, much low. than the benefit of the adverse events. How can you protect yourself? I have this, I think, is known to you, is known to you, but please try and avoid crowds as much as possible. Of course, this is going to become more pertinent after the unlock mechanism start, and reiterating the point that get your COVID-19 vaccine as soon as you possible. Poorly ventilated indoor spaces. Now, these has been linked to the spread of COVID-19 infection spread. And CDC mentions that this is one of the risk factors for spreading. And we have to keep cleaning the surfaces, though there is literature saying that the virus does not survive for more than 48 hours on these surfaces. But we have to keep cleaning these surfaces, and we have to keep cleaning these surfaces with alcohol, with which is the recommended regime that we have to keep cleaning it on a regular basis. Now, what are the treatment options? I think the most important thing is to early identify, and is to take the consultation of a registered medical practitioner. If you have symptoms like sore throat, if you have symptoms like fever, if you have symptoms like people also at this time, people are reporting with stomach upset, body ache, don't sit back at home and keep popping the pills. Please take medical consultation. The most important thing, what we know right now in the disease is that we can give paracetamol. It is better to give paracetamol in the disease rather than giving Disprin. So many of my patients, they come that they say that we want to take Disprin. We have taken Disprin. Don't take it, because there is literature now showing that the virus reduces the platelet count, and these aspirin or Disprin kind of things should not be taken without medical consultation. Paracetamol is a better medication to take. Keep yourself hydrated. Drink plenty of fluid. If unfortunately any of your patients are infected right now, you have to keep them hydrated, because it is very hot, it is very humid, and you need to maintain the hydration. We have to take plenty of rest. Now, what do we know within the hospital? So there are certain antiviral medications like remdesivir, which is still under, I would say, research. That some of the school of thought believe that it is working. The WHO believes that it is not working. So, but still in India we are using it. Now we know for sure that the steroids they are working. If the steroids, they have been shown in the recovery trial in Oxford that when you use dexamethasone, steroids like dexamethasone, they reduce the mortality rate. But ladies and gentlemen, please remember that the steroids are a double-edged sword. Don't rampantly take steroids. If you take steroids, they have to be rationally used, and they have to be tapered it down. I'm not getting into the discussion of the complications, because now we know through the media that different kinds of colored funguses are infecting us. Black fungus, white fungus, yellow fungus, all these have been linked to use of steroids. So if you're using steroids, then please keep a check on your blood sugar, because steroids increase your blood sugar. Please remember, these steroids cannot be taken as your whims, but the steroids have to be under medical control. And the other drug which has been thought to be working are the blood thinners like the low molecular weight heparin. Now the evidence is constantly changing. I echo the Professor Prantal Chakraborty's thought here, and I would like to show that the drug which was initially thought to be a wonder drug like the hydroxychloroquine, this is no longer being recommended, and this is our systematic review which we published way back in May 2020, when a president of a great country was speaking that this is going to be the wonder drug. And we looked at the literature and we said that unfortunately the evidence was very, very less. So evidence-based medicine is constantly changing, and it is also changing for vaccines as well. As we get into the vaccines now, please remember today, if you hear that the vaccine duration from 2 dosage has been increased from 4 to 6 weeks to 12 weeks, don't always think that what is happening, everything which is being told is wrong. As the evidence evolves, the duration keeps on changing. I would also like to highlight certain important issues about before I jump into COVID-19 vaccination, is adult vaccination is extremely important because bacterial co-infection and secondary infection is very common with COVID-19. And one of the commonest bacteria which kills patients in COVID-19 is the Streptococcus pneumoniae. There has been study on acute bacterial co-infection in COVID-19, and it has been seen that secondary infection was with bacteria, pneumococcal pneumonia, is as high as 14.3%. So this is a very, very important thing, that even if the COVID leaves your lungs, the secondary bacterial infection through pneumococcal pneumonia happens in these patients. So what do you do? The Streptococcus pneumoniae, this is it's a notorious bacteria, and the Streptococcus pneumoniae has to be controlled with adequate vaccination. 57.1% of community acquired pneumonia in the country right now is through Streptococcus pneumoniae, and patients who are in the hospitals with COVID-19 infection, they can get this Streptococcus pneumoniae infection. So what do you do? You must also vaccinate yourself, and this is the information I want to share, that only COVID-19 vaccination, of course, is important, but the pneumococcal vaccine, which is an extremely important vaccine I want to highlight here, reduces 35% risk in case of COVID-19 diagnosis, and also reduces 32% incidence of risk in COVID-19 death. So this is extremely important for elderly people who are above 50 years and above, that they receive both the pneumococcal vaccine as well as the COVID vaccines. The global scenario of COVID vaccine development is very, very bright. Ladies and gentlemen, let me tell you that we have at least 184 vaccine candidates, of which 15 candidates are in the phase 3 clinical trials, and India is doing great as well. So it is not only Covishield. Right now, we have only 3 vaccines which has been approved by the Indian government, but very soon you will see many vaccines which will be approved. So don't feel disheartened if you're not getting your vaccine. Look at that list. That list is so long, and the list starts with Covishield. Its partner is AstraZeneca, which is based out of the United Kingdom. It's an Oxford vaccine. This made out of chimpanzee adenovirus. So, and the Covishield vaccine is now 90% of the vaccination in India is happening through Covishield. So currently we have been told that around 22 crore Indians have been vaccinated, of which 20 crore doses of Covishield have been given. Covaxin, it's an indigenous vaccine by the Indian government, and it has been developed by the Indian Council of Medical Research in India, along with this company, which is Bharat Biotech. And many people don't know that the National Institute of Virology is also another important partner of the Covaxin. The number 4 vaccine has already been approved for emergency authorization, but I want to highlight number 3 vaccine, Glycote. Very soon, I would say very soon, in the next 1 month, you will see Cadilla's Glycote vaccine to be approved in the country, because Cadilla's vaccine has already submitted the interim analysis of the phase 3 trial, and this has got a good collaboration from the Department of Biotechnology in our country. So there's another thing which is very, very extremely important, is the Glycote vaccine is being tried and tested in children. A huge number of participants, close to 800 participants in the Glycote phase 3 clinical trial, are children of 12 to 18 years. Many of my patients, many of the doctors also are asking me, when will the pediatric vaccination start? I am a positive person. I believe that the Glycote vaccine will probably usher in the pediatric vaccination in our country, follow it up with the Pfizer vaccination, which is going to come. The list is pretty long. I'm not going to get into details, but let me tell you that the Bharat Biotech is developing an intranasal vaccine as well, which is on the inactivated rabies virus platform, and that can be the game changer. So COVID-19 vaccination, as I told you, ladies and gentlemen, there are 3 COVID-19 vaccines authorized for emergency use in India. Who should get this vaccine, if you ask me? Anybody and everybody who's eligible right now above 18 years of age should get this vaccine. If you have an issue, please discuss it with your doctor. It's extremely important, because it is only two conditions where you cannot take the vaccine. Number one, where you have a history of anaphylaxis. What is anaphylaxis? When you have given a vaccine or you've given a history of anaphylaxis with a previous vaccine. So that means you've been given a vaccine anytime in your life, and within minutes of giving the vaccine, you develop severe respiratory distress, reddening of the face, reddening of the body, and you could not breathe. That is severe allergic reaction. That case is known as anaphylaxis. So you cannot take the COVID-19 vaccine in that case. Who else cannot take the COVID-19 vaccine? The COVID-19 vaccine cannot be taken by those people who have individual allergy to the component of the vaccine. I've been asked again and again and again that I have got allergy with prawns. Amar begune allergy ache. I have got allergy with dust. Can I take the vaccine? The answer is yes, yes, yes. Because, ladies and gentlemen, remember that you will be vaccinated in an infrastructure which will be there to control your severe allergy. A nurse will be pushing the vaccine. You will be monitored for 30 minutes, and there will be an anaphylactic kit which will be given so to the people who are vaccinating it. So these prawn allergy, these dust allergy, this nasal allergy, they should not be an issue for you not getting vaccinated. In fact, I want to share with you that many of the people who have not taken the vaccine because of this have suffered a lot as well. So it is only the individuals with the component of with which it has been prepared. If you have vaccine, if you have allergy with that, please don't take the vaccine. And anaphylaxis, please don't take the vaccine. Everybody knows this, that India started the vaccine rollout in a sequential manner. And why did India do this? Because we had less vaccines, because we wanted to protect the healthcare workers, because we wanted to protect the frontline workers who were fighting day in and day out with these COVID-19 patients and maintaining the COVID-19 infrastructure. 1st May 2021, 18 years and above vaccination and start. I appeal to all the students who are listening to this particular program, please go ahead and vaccinate in yourself and play an important role for the country, because every vaccine which is taken by the individual, you are developing herd immunity. If you take your vaccine, you are helping the society, you are helping the community by developing the herd immunity. Now I will come to the individual vaccine. It is a great privilege for me to share with you the Covaxin, because I am very proud of this vaccine. This is a completely indigenous vaccine, India's own vaccine developed with ICMR, Indian Council of Medical Research, and the National Institute of Virology. This vaccine has been developed. It is a killed vaccine. So the entire body of the virus, I'm not getting into nitty-gritties, but the entire body of the virus is present in this vaccine. So the vaccine develops antibody not only against the spike protein of the virus, but to the different components of the virus. The phase 3 of Covaxin is still not completed. Many of the people believe that the vaccine trials have been completed and how close, fastly they have been completed. So something hanky-panky has happened. Let me tell you, ladies and gentlemen, whether it is the Pfizer vaccine, whether it is the Moderna vaccine, whether it is Covaxin, Covishield, everywhere the phase 3 trial is underway. And what has happened is emergency authorization has happened. What is emergency authorization? Emergency authorization means in case of a pandemic, we cannot wait for years together for the trial to complete, because millions and millions are getting infected, thousands and thousands of lives are getting, they are lost. So what the regulator does, the FDA, and in case of India, it is the DCGI, it looks at the interim data. So the interim data, if the interim data, they have a very well-defined cutoff, 50% protection mark. If the interim data shows that the group which has received the vaccine vis-a-vis the group which has not received the vaccine, there is a 50% protection mark, the approval is given with a clause that it can be revoked later if it is not found safe. So it is an emergency authorization which has come with Covaxin as well with Covishield. Now with Covaxin, neutralization of the UK variant, which we are very bothered about, has been shown by ICMR. ICMR though has claimed that the UK variant is being neutralized with Covaxin, and the phase 2 data has been published in the world famous Lancet journal, which mentions that the recorded efficacy is close to 85%. Covishield. This is the vaccine which is being produced by Serum Institute of India. And ladies and gentlemen, please remember that Serum Institute of India is the largest vaccine producer in the world. So it produces vaccines and it sends vaccines to all the countries in the world. So Serum Institute of India, Oxford University, and AstraZeneca have have all come together and they are developing this vaccine. And the phase 3 data is currently being evaluated for before it's going to be completed, and it is another vaccine which has to be used for restricted emergency authorization. Now, what is Covishield? Covishield, the outer body, the body is of chimpanzee adenovirus. This adenovirus is a common virus which is being used, which infects the chimpanzees and causes upper respiratory tract infection. So will it infect us? The answer is no, because the capability of infection is taken out from the adenovirus, and the outer aspect of this virus, there are different spike proteins which have been put from the coronavirus by genetic modification in the lab. So it's a beautifully looking virus. The body is of adenovirus and the spikes are of the coronavirus, because we want to develop the antibody against the spike protein of adenovirus, of the coronavirus. So this is what is Covishield. What is the efficacy of this Covishield? A lot of controversy is going on this. So the initial efficacy reported, efficacy means protection rate. The initial protection rate reported was 76%, but a Lancet article on February 2019, on February 19th, 2021, mentioned that if the two doses are given 12 weeks apart, the efficacy jumps from 71 to or 76% to 81%. And on the basis of this, the government of India has now decided that the two doses will be shifted to 12 weeks apart, 12 to 16 weeks apart. And I think we have to do a lot of proper information, more, sharing with people. And that is why I keep on writing that, this is extremely important, that it is not that one of the issues was that we did not have vaccines. That is correct. But the other is there is a scientific reasons for which the information has spread, the duration of the dosage has been spread. Now, if we compare Covishield and Covaxin, both of them, the biggest advantage, if you really look at, they can be stored at 2 to 8 degrees Celsius. Many people have been asking why Pfizer, why Moderna is not entering India. You have to understand that 70% of India lives in the rural place. 70% of 80% of our infrastructures, though medical infrastructure, don't have the minus 20 degree refrigerators, minus 20 degree deep freezer. Hence, we have to find a solution, a vaccine which can vaccinate majority of our population, and hence Covaxin and Covishield were given preference ahead of the Pfizer and Moderna vaccine. And as a result of which we are getting these two vaccines under emergency approval in the country. Now I will come to the Sputnik 5 vaccine, and this is one of the another interesting vaccine which has been developed by the Russian Military Institute in Russia, which is the Gamaleya Military Institute, and the Dr. Reddy's laboratory in India has collaborated with the Gamaleya Institute, and they are taking out this vaccine. Now, if we put Covishield on one side, Covishield had adenoviruses of the same type. They were the chimpanzee adenovirus, of which the infection causing capacity was taking out. But the similar pattern, Sputnik vaccine is there, but these are the human adenoviruses, and there are of two different components. There are two adeno human viruses are taken, and on the outer aspect, the spike proteins of the the coronavirus has been put. The spike protein has been put to generate antibody against the spike protein. Now everybody is asking me, is Sputnik working? Is Sputnik working? I would say the Russian data is published. The phase 3 Russian data has the clinical trial efficacy rate of 91.6%. It is pretty high in comparison to the phase 3 clinical trial data of Covishield, which is roughly around 71 to 72%. The phase 3 clinical trial data of Covaxin is still not published, and I think it will be published very soon. But according to some sources in ICMR, it is speculated to be roughly around 75 to 78%. So Sputnik vaccination is already, the Sputnik vaccine has arrived in India. I've been told that some hospitals will be starting Sputnik vaccination in Kolkata from the next week. So if you really look in a country like India, that what are the different vaccines which can come and could be managed also, because there is a logistic issue, there is a cold chain issue. The Pfizer vaccine, which has efficacy rate of 95%, but this requires at least minus 30 to minus 60 degrees Celsius storage capacity. Same with Moderna. So, but with Oxford and AstraZeneca, Johnson and Johnson single dose vaccine, ladies and gentlemen, this is another game changer vaccine which is being used in the United States. We have been approached through the clinical trial, but now that has been put on hold with the basic clause saying that the government might approve the Johnson and Johnson Janssen vaccine, which is a single dose vaccine, very soon, because there is a lot of pressure on the government to approve those vaccines which are already approved in other countries, namely 5, 6 countries, the United States, the UK, the Japan, the European Union. So if all these countries have approved those vaccines, the bridging clinical trials need not be done in our country. And of course, you have the Chinese vaccines, which are being used in China and in many parts of the world, and the Novavax vaccine, which is a protein-based vaccine. But so the requirement, one of the important issues of the vaccine is the storage capacity. I'm very hopeful about this vaccine, which is a Glycote vaccine, and the phase 3 data, as I mentioned, will be evaluated, is undergoing evaluation, and very soon you will see that the Glycote vaccine will be available in the country. And biological E vaccine is another indigenous vaccine with 028 dosing. The phase 2 data is currently undergoing, and we will be, I would say, we will also see the government of India has requested for a sizable amount of biological E vaccination. Now, the next myth about the vaccine is that everybody and anybody will get the side effect, and these side effects are going to be very, very bad. So don't take the vaccine. So let me tell you, in pharmacology and in medicine, there is one dictum: anything which has got an effect will have a side effect. Something which does not have an effect will not have a side effect. So don't be scared of side effect to go ahead and take your vaccine. What are the common side effects of COVID-19 vaccine? There could be pain at the injection site, which I have personally witnessed, which I have personally experienced. When I received my vaccination jabs, I had pain at the injection site. I had fever and I had fatigue, but this all went away within 24 hours. There could be headache, there could be muscle pain. Some of the friends of mine have come back with diarrhea and chill. But these are not for these issues. If you stop taking the vaccine, I would say you are making a mistake, because this is the only weapon, or is the only shield which can protect you from the coronavirus. Very, very less anaphylaxis reactions have been reported in the country out of this 22 crore vaccination. And the long-term side effects usually have not been reported. There is a lot of speculation which is going out, and you will see a lot of, I would say, fake news. Don't believe on those fake news, because if you really have to check on the long-term side effects, the long-term studies are undergoing in the laboratories right now, whichever company has taken out these vaccines, and the clinical trials are also going simultaneously. So nobody on earth can say that what is the long-term side effect. But these vaccines have been prepared with utmost concern, and these vaccines are safe as the data is evolving in the world as well as in our country. So after vaccination, ladies and gentlemen, there is one myth that the moment I get my first vaccine, I will have antibody. It's a wrong myth. It's a wrong concept because you have to give the body some time to develop the antibody. And when the antibody develops, at that point of time, you have to carry on with your COVID appropriate behavior. The most important thing, wear mask and maintain social distancing. This is extremely important. So, and the other thing is that if that COVID vaccines can never ever give you infection. There are many patients of mine who are saying, I had gone to take the vaccine and after 6 days, 7 days, I have got the fever. It is because of vaccine I have developed COVID-19. I have told you the current scenario of the COVID-19 virus. The adenoviruses which are present in Covishield and Sputnik, they don't have they don't have the capacity to produce any infection. The killed virus in Covaxin can never produce an infection. So how did you get the infection? You got the infection very unfortunately in the contaminated atmosphere, in the contaminated surroundings where you had gone to take the vaccination. So this is a very common thing which is happening to many people. So I would say be very careful when you are going for your vaccination process and maintain all COVID appropriate behavior. Coming to the other myths of the vaccination process. Very common myth which is present in the medical fraternity is because the vaccine development requires 6 to 8 years, the COVID vaccines are unsafe because it was developed so quickly. This is absolutely not correct because the risk benefit analysis is done by all the regulator. The risk of giving the vaccine vis-a-vis the risk of not giving the vaccine. When you see the vaccine and then if you don't give the vaccine, more people are dying, more people are getting ventilated, hospital beds are getting blocked, the people who require oxygen are not getting oxygen. So what these vaccines are doing across the world, whether it is Covishield, whether it is Pfizer, whether it is Covaxin, it has shown to reduce hospitalization. It has reduced ventilation. That is the most important thing. So ladies and gentlemen, if somebody tells you that these are unsafe because they have been fast forwarded, this is not true because there is a very structured method of developing the vaccine. This is not the forum to discuss that. One day we can discuss on that. What is the government guideline? It's a 39-page document, and we had to go through that document when we have to develop the Sputnik vaccine at our hospital, and we are made to follow each and every clause. So don't think that the government is playing with lives. This is not correct. This is not a thing. No steps are being skipped. The mRNA vaccine, like tomorrow, Pfizer vaccine will come to India. The Moderna vaccine will come to India. And if you want to get vaccinated, people are asking me the mRNA. Absolutely not. Absolutely not, because the mRNA never enters the nucleus of the cell and never interacts with the DNA of the human cell. So it cannot alter the DNA and cannot make you a different human being. So this is a very bad myth which is going around in the WhatsApp university. And again, as Professor Chakraborty and our Honorable Vice Chancellor was mentioning, that infodemic, there is so much of negativity about the vaccine. The reason is, ladies and gentlemen, please believe there are two lobbies who are always there in the world. One which supports a good movement, one which does not support a good movement. And vaccination is one of those areas where the anti-vaccine lobby has always worked. I want to give the example of polio vaccine. It was told that if the polio vaccine is given to Indian people, that certain section of the Indian people will lose the reproducing power. It is absolutely, totally wrong concept which was given just to stop the polio vaccination program. And we did not believe in it, as a result of which we were able to eliminate polio from our country. I will also say that please don't believe in these myths. People have been told that COVID-19 vaccines have severe side effects like allergic reaction. I am an example myself, and people who are sitting here, Professor Panto Chakraborty, they have taken their vaccines. Others have taken the vaccines. I mean, we are commonly, routinely giving vaccines to so many people. Severe side effects have not been reported. Few side effects are reported which can be severe, but that has to be monitored. So again, remember that you will be given a vaccination in a medical center, whether it's a hospital or a community vaccination center. There will be doctors, there will be nurses, there will be an anaphylaxis kit containing injection, adrenaline injection, hydrocortisone. If something ever happens to you, you will be monitored. So don't get scared that because of allergic reaction, I will not take my COVID-19 vaccine. Another important myth which is going out is COVID-19 vaccine causes infertility in the woman. It is absolutely a bogus myth because the amino sequence shared between the spike protein and the placental protein, though this is being shared, it is too short to trigger an immune response and it does not affect the fertility. So it is not a truth. There are many people who are saying that I've already been diagnosed with COVID-19. I should not take my vaccine. Ladies and gentlemen, COVID is relatively a new disease in comparison to tuberculosis, which is present for hundreds of years. COVID is only 2 year old. If you have COVID-19 infection, you will develop antibody, but trust me, these antibodies are lasting for very, very less time. They're lasting for 6 months, maximum to 9 months, whichever data is present. So these vaccines are going to be the booster dose. They are going to promote more antibodies in you. So please go ahead and take your vaccine. The other thing which is commonly asked is why should I take once I take a vaccine, I will not wear my mask. This is not correct because we have to follow that as we have been told that the vaccination, after vaccination, 4 weeks, 8 weeks is required to develop the antibodies. So in that time, you can get infected and the vaccine can go waste. So fully vaccinated people, when they are meeting fully vaccinated people. So in United States, the Center for Disease Control has said that if you are sure that you are meeting fully vaccinated people after 6 to 8 weeks, you can talk to them, meet them without your vaccine. That is possible in a country like United States who have already vaccinated 45% of their population. But in India, where we have still not vaccinated 20% of our population, I think we have to carry on wearing the mask. We cannot, again, I have told you that you can get COVID, you can never get COVID-19 from the vaccine. Please don't keep this in your mind. Many young people are asking, I am not at a severe risk of complication of COVID-19, so I do not need the vaccine. Ladies and gentlemen, the second wave, as we are seeing, has been more severe in the middle age group, and nobody and anybody can predict who is going to get the severe complication because it is not the virus which is causing the severe complication. It is the immune system of the person which is causing the severe complication. So what we need is, regardless of your risk, you can still contract the infection. It is very, very important for you to get vaccinated, not only for yourself, but for your family and for your community. And if I receive the COVID-19 vaccine, I'm at a greater risk to become sick from other illnesses. There is no evidence to suggest this, that if you get the COVID-19 vaccine, you will become sick from other illnesses. So my do's and don'ts for vaccination. What do you do when your turn comes? Take your vaccine. You must contact your physician. Always have a physician. Try to talk to him if your adverse events of vaccination is lasting more than 72 hours. The reason is you might have contracted a disease very unfortunately while you have gone ahead and got the vaccine, not from the vaccine, but from the contaminated atmosphere or the contaminated environment. Please help people in your life to get the vaccine. The elderly people who are sitting at home, try and get them vaccinated. Please remain up to date on your vaccination status and the information and refer to the Ministry of Health, Government of India, as well as Government of West Bengal website, because they give the most concrete, the most stop wearing masks, washing your hands and practicing physical distancing after you've got the jab, because you don't know whether the person in front of you has got the jab or not. Don't assume that everybody is safe because you are safe. And my another take home message would be elderly people in your house who are above 50 years of age should take their pneumococcal vaccine. And again, I'm going to reiterate this, and thanks to Pfizer for sharing this very important slide, that the aged population above 50 years and above, they are getting infected in once they are getting cured of COVID-19, or when they are in the hospital with COVID-19 pneumonia, they are getting this infection and they are getting this deadly infection. So if you look at the high risk of COVID-19 pneumonia or COVID-19 infection and the high risk of pneumococcal pneumonia, they are absolutely similar: chronic heart disease, liver disease, kidney disease, lung disease, diabetes, alcoholism. So all these people above 50 years of age, it is better that you should get vaccinated. Even cigarette smokers are very, very susceptible to get the pneumococcal infection. So the Geriatric Society of India recommends the use of pneumococcal vaccine to in these individuals. So I would say take your COVID-19 vaccine. Along with that, take your pneumococcal vaccine, because that will give you double protection. Adult vaccination is extremely important because it can reduce your hospitalization. It can reduce so many diseases. So adult vaccination is not only for pneumococcal diseases. There are so many diseases, and I'm not going to get into those details because you can always consult your doctor in case of any query. And especially, I would highlight the pneumococcal pneumonia, because this can definitely help you to reduce the infection. So in case you are interested, you can get in touch with LB Care. I want to thank them for helping me develop and to deliver a lot of vaccination to many of my patients. And this is the phone number in case you are interested. I will share this number at the end of the presentation. So the summary of this presentation is: after the emergency approval of DCGI, Drug Controller General of India, the process of vaccination administration in India has begun primarily with Covishield and Covaxin. 90% of the vaccine has been Covishield and they are safe. Sputnik vaccine is the newest edition. It will be available soon. I've been told next week it will start in Kolkata. The 18 years and above is getting vaccinated in India, and the vaccines, ladies and gentlemen, are safe, and it is a necessary for all Indian citizens. It is extremely necessary for all Indian citizens who are above 18 years of age to take your vaccines. Avoid all kinds of myths related to vaccination, and please, please, please consult your physician for candid information. Please do not self-medicate. If you have fever after vaccination for 3 days, 4 days, 5 days, 6 days, just don't self-medicate with paracetamol. Please be in touch with your doctor through telemedicine, because telemedicine is the in thing now, and lot of patients are taking the advantage of telemedicine. Prevention of this disease, which is creating a havoc and changing the world forever, is the best strategy currently, which can be done by social distancing, regular hand washing, wearing of masks, and definitely, again, I would reiterate, vaccination. So let us be informed, let us be prepared, let us be smart and safe and not be scared. Let us be ready to fight COVID-19 through these strategies. This is the WHO slogan, and I wish that all of us remain informed, prepared, smart, and safe to defeat COVID-19. With this, I would like to end my presentation. I would like to thank Honorable Vice Chancellor, Sir, and Professor Moitro for giving me this opportunity, for sharing my limited information in this field. And if there are questions, I'm more than happy to take it. Thank you very much. My acknowledgement to Pfizer India for the support in the slides, as well as to LB Care India for supporting this initiative. Thank you, everybody.
Thank you, Dr. Subhrojyoti Bhowmik, actually for such a nice presentation and very informative, and I think clearing a lot of doubts. And I think people will be now encouraged, whoever I think participated in this program, and also they will spread this news to others, that what is the practical significance of this vaccination and what is actually what we should do to accept this vaccination and be ready for fighting against COVID-19. And now actually we have a lot of questions, and I will request our Honorable Professor Pranto Chakraborty also to join us for this answering these questions. Actually, these questions, let me just point out. First question is happy to know about the adult vaccination. Want to know the details age group wise. I think this has been already answered in the slide. Anything has to be added further?
I think very important question, and I thank the person for raising this.
Yeah, it is from Arindam Rai. Yeah.
Yes, thank you, Dr. Arindam Rai, for that wonderful question. I think we also have to understand that in India, adult vaccination is very, very neglected. We are not taking vaccines which are required for adults. We need to take these vaccines. As I mentioned, my humble suggestion to all the adults above 50 years of age is to get vaccinated with pneumococcal vaccine. It's extremely important because COVID-19 vaccination definitely will protect you from COVID-19 pneumonia. But what we are seeing, I've been told by critical care experts that many of these patients who are going into ventilation or who are with CPAP or BiPAP for a longer duration, they are developing secondary bacterial pneumonia. And many of them are where Streptococcus pneumoniae is playing a major role. So I would say that there are definitely there are a lot of other adult vaccinations to begin with. There are chicken pox. In case of females, there are other vaccination, but if one vaccination has to be taken, it should be the pneumococcal vaccine, which should be taken. Of course, after the COVID-19 vaccine, because right now COVID-19 vaccine is a huge pandemic, we need to play our part and take the COVID-19 vaccine. And after 4 weeks, we can definitely take the pneumococcal vaccine as well.
Yeah, the next, thank you. Anything Professor Chakraborty has to add?
No, nothing to add.
Okay. So the next one is only, it's not a question. Om Gupta has thanked us for this valuable program. And the next question is, for many people are believing that Sputnik is good and Covaxin is not good. People are getting confused which vaccine is good or bad. Can you please elaborate? Okay, this is anonymous attendee.
Anonymous, I wish I knew the name because I think it is a great question. I want to congratulate the anonymous person who's asking this question because everybody thinks. So I will first try to answer this in this way, that when we are hungry, we really don't think that we need biryani, or I would say to eat and quench our the hunger. Right now, we need an efficient vaccine to protect us from two things, ladies and gentlemen. One is death from COVID-19. Another is hospitalization from COVID-19 in our country, because we have seen what has happened in the second wave. The doctors who are sitting here, Pranto sir is sitting here, I have seen in my hospital, the healthcare community was stretched to the maximum and people did not find oxygen cylinders. People did not have beds. We did not have beds. We did not have medicine. So what these vaccines are doing, whether it is Covishield, whether it is Sputnik, whether it is Covaxin, they are reducing the intensity of infection. Nowhere it is written and no company is publicizing that with vaccination you will never have infection. Now that is another myth, which is that if I take the vaccine, I will never have the infection. This is not correct. You will have the infection. No vaccine on earth is 100% protective. No drug on earth is 100% effective. So you will have the infection, but the infection is going to be mild. The infection is not going to lead you to ventilation. The infection is not going to lead you to death. Of course, there will be certain aberrations where death will happen, where ventilation will happen, but that cannot be the rule. The rule is across the world, whether it is Pfizer vaccine in the United States, Israel has clearly shown, the Israel is a prototype model where the Pfizer vaccine has been shown to reduce death, complication, and the ICMR data, which was released somewhere in middle April, it is clearly shown that after 2 vaccination doses, number of people requiring hospitalization is only few thousands. So where lakhs and lakhs of people have received it. So ladies and gentlemen, please don't have this feeling that Sputnik is better than Covaxin is better than Covishield, because there is no head-on comparative study which has been done keeping the three vaccines side by side in a controlled environment. We can only say that A is better than B is better than C if they are tested on the same population in the same controlled environment, which has not been done. Unless and until that report is out, it is very wrong, it is very immature to say that A is better than B is better than C. All the three vaccines are protective. All the three vaccines are saving you from death. Please go ahead and take your vaccine, whichever you get right now. We cannot choose. This is my personal opinion.
Okay, thank you. And next question is not exactly on COVID, this vaccination, but Mr. Saurav Ghosh is asking when this college will be open and when they will be having examination in the process. But actually, it depends on the situation, I believe. But Dr. Bhowmik and Dr. Professor Chakraborty, they can add actually if there is any further information. But it depends on the situation, actually, when the things will become normal.
I also agree. I think what I've been told, and my understanding is the infectivity rate has to be less than 5%, and the vaccination rate of that particular district has to be at least 20% and above. Then only they will be unlocked and the colleges will open. So if you are talking about Kolkata as a district, the infectivity rate has to come down to less than 5%, and the vaccination of the Kolkata as a whole has to come to 20% of the population. Is then only I think it will be safer to open. My personal opinion again. Pranthar sir, you want to add something?
No, I think absolutely. And it's very important that we prioritize. So obviously the decision will depend on whether we are doing more harm than good. So as long as there is a chance that there can be another wave, and again the health system would be stretched, obviously the policymakers would put certain restrictions and then look at the scenario and do it. But the person who has asked this, I think the only thing is, I know people are missing their schools and colleges, but I think knowledge is a continuous process. So they can keep on learning. You can imagine the plight of the students who are supposed to face their first board examination. So it is all about trying to help the human race survive, right? So that is most important, and we should look upon the greater picture, the bigger picture, rather than thinking, when my things will become normal.
True, absolutely.
So next question is from Bornita Bhowmik, that when can anyone get vaccinated after having COVID? Okay. So if the person is getting affected by COVID, then
so answer is 3 months of recovery. From recovery, you should, after you've recovered. So if you have got the infection on 1st May, and if you got a mild disease, so 10th May, if you don't have 3 days of fever, 10th May you have recovered. So anytime after 3 months from that, so I would say anytime from 9th August onwards, you should take your vaccination.
Okay, thank you. Then the next question is from Om Gupta, that can I get the present PPT? Okay, actually
yes.
This is being, this is for information for everybody, that this is being, I think, simultaneously on live in YouTube and Facebook also. So YouTube is having the record of the whole program. Okay, and apart from that, if you approach us, obviously we'll try to provide that particular in this PPT. Okay, then there is another question from Alok Maiti. As mask type is very important, why government is not controlling that?
Mask type. I think, I think we will rather put it in this way, that what the WHO says, what the World Health Organization is saying, that in case of massive surge, it is better to use a medical mask. And now that we know that the massive surge we were in midst of a massive surge. We are still in the midst of the second wave. Today also 1 lakh plus cases have been reported in the country. So it is for our own benefit that we have to wear our own mask and ensure that the others wear the mask properly. I understand that the government should make it mandatory, but the government can just, there are regulations about helmets also. But how many of us do actually comply to these regulations? I think it should come from within us that if we don't wear proper masks, we will infect us and then we will infect our loved ones. With that thought process, I think definitely government has a role to play, but more than that, as I told, as an individual and as a member of this society, we should do our bit and then think that the government will play its bit as well. So let's wear medical mask and wear proper mask so that we don't get infected. Use the mask properly, because as wearing the mask is very important, removing the mask is equally important. Not touching the mask repeatedly throughout the day. There are many people who are keep on touching the mask throughout the day, and then they touch their eyes, then they would open and they would touch their other parts of the face. Don't do it. It is going to infect you. So let's play our bit, as Professor Chakraborty said, that let's play our bit and then expect the government will also do the bit for sure.
Okay, thank you. The next question is, which sanitizer is good? Because there are many beautiful smell sanitizers available in the market.
That is a very good question. I would say the sanitizer which has got at the alcohol base, 70% alcohol base is the recommended sanitizer. And whether it is beautifully smelling or not beautifully smelling, please look at the ingredient. That if the ingredient has 70% alcohol as the base, then only that alcohol is killing, nothing else matters. But even if it is not beautifully smelling, please, you can use that particular sanitizer.
So thank you. The next question is, I want to ask a question to everybody. Covaxin or Covishield is better to enhance the susceptibility to infection after giving 2 doses of vaccination. Why should people face so much of problematic occurrence to a great extent? And what is anaphylaxis? Okay, I can't get any vaccine. Please help me to get uh, uh, uh,
The vaccine.
anonymously to get the vaccine. Okay, but
Okay.
whether we can.
So I think the first one, I'll answer the second question first. What is anaphylaxis? Anaphylaxis is the severest form of allergic reaction where after the introduction of a drug or a medicine or a vaccine, you have within few seconds, you will have severe allergic reactions in the body consisting of redness of the skin. There will be itching. The person is not able to breathe because there is laryngeal edema. So the larynx muscles, they get swollen and the person is not able to breathe. There is respiratory distress. And if this is allowed to continue, then there is death because of the laryngeal edema. The oxygen cannot enter in the lungs and ultimately cardiorespiratory arrest happens. So that is the severest form of allergic reaction. But luckily, we have a medication which can save or which can curtail the anaphylaxis within few minutes. And that usually wherever vaccinations is happening in India, this anaphylactic kit is given with injection adrenaline and hydrocortisone, so that is managed. The second question is why people are facing so much of difficulty for the second dose. I agree. If I understood that question correct, that for the second dose, I think what she meant was probably for the second dose. There is a scarcity of vaccine in the country. I agree with you. But let me tell this viewer that no vaccine is a wasted vaccine. So don't think that if you have not taken your Covaxin at 6 weeks and you've taken it at 12 weeks, the vaccine has been wasted. There are memory cells in our body, in the immune system, which recognize the virus antigen when it is being sent. So every time the next booster is given, the memory cells increases. So I definitely agree with you that this is a problem nationwide. And now I'm sure that with more number of vaccines coming in and the government increasing the production capacity and stopping the the exporting of vaccine, there will be more vaccines which will be available. Please be patient. Remember that if you lose the time duration, it is not the end of the world. Please maintain your COVID appropriate behavior. Whenever you get the second vaccine, get the second vaccine. And the last one is regarding availability of the vaccine. I mean, you have to do some homework. Of course, you can reach out to the university and we can try and guide you if wherever the vaccines are available within our limited resources.
you. Next question is from Shandipan Mishra that, sir, can you please repeat what is the actual duration between two doses of vaccine?
Yes, so basically the current guidelines mention that Covishield first dose and the second dose has to be given between the first and the second dose duration has to be 12 to 16 weeks. Covaxin, there is no change. You will take it 4 to 6 weeks. And the Sputnik vaccine is on 21 days. So first dose followed by the second dose is on 21 days. That is what the duration of two doses. I mean the gap between two doses.
Okay. Then the next question is, what is the difference between coronavirus and adenovirus?
Okay. So I'm not I'm not a microbiologist, but I'll try to the best of my capability. So these are different kinds of viruses. The coronavirus is an RNA virus, whereas an adenovirus is a DNA virus. The coronavirus is basically, as we know, that the COVID-19 virus we have seen the pictures and photographs of how it looks. It has got different spike proteins with which it attaches to the human cells, and the adenovirus, they are commonly causing the infection of the upper respiratory tract and the lower and the GI tract. So it can cause diarrhea as well. So both the viruses are infecting in the human beings, and they have been infecting us for a longer time. Coronavirus is seen, the infection is seen in animals as well, and sometimes from the animals it jumps into the human beings, which has been found in COVID-19 virus, that it has jumped from the animals to the human beings, and this has come with a new genetic makeup. So that's to the best of my ability. Professor Chakraborty, anything else to add for adenovirus? This is my
No,
information.
no, no. I think people should realize that most of us have already had adenovirus infections. Okay. So the common cold and all, a significant part of it is caused by adenovirus. So there are so many viruses, and some of them, you must remember that these are not living beings in the perfect sense of the term. So they need another person to replicate and survive. So the basic difference between a DNA virus and an RNA virus is the RNA virus is capable of changing its characters. I'm not going into mutations and all those things much more than a DNA virus. So I think what he said is absolutely correct. And you have to understand that coronavirus as a family has been there for long. This particular variant is new, and it is so much new that humans are facing a problem in tackling it.
So, actually, King Shukra, that which vaccine is best and less side effects, and which are suitable for my mother, age of 43. Okay.
So, sir, I will again reiterate the point. There is nothing called a best vaccine if there is no comparative study between vaccines. So this is right now at this point of time, whatever scientific literature is present, we cannot say which is best because each has been tested and developed and tried in a different controlled environment. What we have right now is the published data of these vaccines. I again want to tell Mr. Rai that all vaccines are protective and they're protecting against death and ventilation and hospitalization. If you ask me about which has got the least side effect, that is also not, it is not possible to answer it because every vaccine will have some side effect. The common side effects include the pain at the injection site, the fever, chill, rigor, body ache, and sometimes the diarrheal diseases. So for me, I would say that if you're looking at a holistic immunity, then a killed vaccine is the Covaxin. That means you got immunity against not only the spike proteins, but of the different viral components, the nucleocapsid and everything. So that is the holistic immunity will come with Covaxin. But if you're looking at the immunity against or the antibody against the spike protein, then the Covishield and the Sputnik is able to do justice. So it depends on you, and I would say it is better to discuss with your doctor. Covaxin, I would say, is preferable in patients who have got kidney diseases, who have got any kinds of liver failure diseases, because these are safer vaccines to be given in these patients. Whereas if the patient is healthy, I assume your mother is healthy, so she can take Sputnik or she can take Covishield, she can take Covaxin as well.
Okay, now we have a lot of questions. Actually, 57 questions still remaining. I find. So, what shall we do? Because we can select some few, and rest of the questions can be answered actually by mail and other. Okay.
Yes, yes, sir, absolutely. We
Right?
can select
Otherwise,
few
it's
questions.
time
Yes,
to
sir.
cover all these questions. So, I am selecting one that from Dr. Chandan Datta. Why Covaxin is not list in WHO list?
So that is a great question, and let me tell you, even Sputnik is not on the WHO list. That it is the WHO follows a certain mechanism for which it approves the vaccines for the world, and that is that it reviews all the published literature by its independent committee, the WHO Immunization Committee on COVID-19, and we are what we are aware of that the Covaxin data, the published data of till phase 2 trials has already been submitted to the WHO and it is reviewing. Covaxin, ladies and gentlemen, please remember, is not only a private vaccine. Two government entities are involved with the development of Covaxin, ICMR as well as the National Institute of Virology, Pune. These are these are these are entities of high respect and great credentials from the Indian government. And Indian government, I am sure it's a matter of time that Covaxin will be approved by WHO, because Covaxin is also being used in Brazil. Covaxin is being used in many lower and middle income countries which are apart from India. So it's only a matter of time that Covaxin will get approved. For the information of the public, it was only on Friday that the Chinese vaccine Sinopharm has got approved by the WHO, whereas the vaccine was in use in many countries for the last 1 year. So it's a time-driven process. It will happen.
Okay, thank you. So Dr. Shukhendu Jana is asking, is it indicated that less side effect means less immunity?
No, no, absolutely not. Less side effect does not mean that there is less immunity. Something like you are saying that if you take a BP lowering drug and if you don't have side effect, it will not lower your BP. Absolutely not. There are certain, our side effects or the adverse effects are genetically determined. And this is what we say as pharmacogenetics. So it depends on the different kinds of genes which are present in our liver, in our kidney, and as well as in our immune system. So this is genetically determined. Within the family, you might say that the father is having less side effect, the mother is having more side effect, and the child is having probably no side effect with the same drug. So it is totally genetically determined. It does not mean that if you don't have side effect, the vaccine has not worked.
Okay, Sinjan Bhowmik is asking, as Dr. Subhrojyoti Bhowmik sir mentioned, that the vaccination for both COVID-19 and pneumonia is required for us. Which vaccine should I take at first?
Yes. So that's a great question. I would say right now go for COVID-19 vaccine, because that is a pandemic. Please start with COVID-19 vaccine and complete your, at least for elderly, I am requesting for elderly for above 50 years of age, please get your pneumococcal vaccine as well. After that, after you finish the COVID-19 vaccine.
Dr. Titil Dr. Samanta, my children are not yet vaccinated. How can I protect them from COVID-19?
I did not get that question. Is he meaning that he is not vaccinated from COVID-19 vaccine, right?
Her children are not vaccinated yet.
So I understand that the children are not vaccinated with COVID-19 vaccine. So, madam, you have to understand that COVID-19 vaccination in children has still not begun. Trials have just begun. And I am hopeful that if the government of India strikes a deal with Pfizer, then I would say that in few months, we will see the Pfizer vaccine arrive in the country, which can be used for vaccination of children. In the interim basis, madam, you can vaccinate your children with the quadrivalent influenza vaccine, because that has been now recommended by IAP, at least in Maharashtra, where they are anticipating the third wave in children. So get vaccinated for the influenza vaccine, the flu vaccine, what we say, as well as the pneumococcal vaccine in children. So pneumococcal vaccine is approved in India for children. So get these two vaccines done. If you have any more information, you want any information, sir, with your permission, they can get in touch with me also. Not a problem.
Thank you. So another Ovilas Sarkar is asking, sugar patient, sugar vaccine neowa jabe? That means sugar patients, can they have vaccine?
I told this again and again, sir, that these sugar patients are at the high risk. So you are asking something like, if a person is a member of parliament, do I take the bodyguard or not? And normal people don't require bodyguard. Member of parliaments require bodyguard. So I would say, if you are a diabetes patient, take your bodyguard, take your vaccine.
So is it safe
Sir,
to take
can we take one question live, sir?
No, Prem Kumar?
Yes, sir. Can we take one question live, sir?
Yes, no, but actually 61 questions are
Yes,
there.
sir. That's why, sir.
That's right. Okay, you can take, no problem. You just.
So let us take one or two questions. After that, we may go for it, sir.
Okay. So that is say.
Sir, good afternoon.
Cost of Bhowmik.
Yes, sir. Sir, I have a question that who approved in emergency cases that Sinovac, which was made by Sinovac Biotech, a Chinese virus, which is approved by virus. They are the same technology that they use the inactive COVID virus, but vaccine was not approved by that in case, but because they are the same type of vaccine.
Yeah, so I answered this question, Kaustav, that there is a time process driven mechanism in WHO, World Health Organization. You have to remember that they are fighting for developing health policies for fighting the COVID-19 virus, and they are also helping many poor countries in the world. The world does not consist of only 20 countries of United States and European Union, India, and few other richer countries. It consists of 180 countries, which are many of them don't even have any access to vaccines. Countries like Mongolia, countries like Kenya, South Sudan, countries like Egypt. So they have not been able to get their vaccines yet. So what WHO follows is they will have an advisory committee on vaccination approval. As it is submitted, they are approved. So the data has been submitted and the WHO goes through the published literature. So the publication on Covaxin has come out in February and that has been submitted. We are expecting that what you are saying, that if Sinopharm has been approved, the Covaxin will be also approved very soon. It is a matter of time only.
Okay, thank you.
One next person.
So we have Dr. Hussain, sir.
Hello.
Yes, Dr. Hussain. Good afternoon.
Thank you, Dr. Subhrojyoti Bhowmik, for your excellent presentation. This is really very much informative and helped us a lot. My specific question, just I arrived from hospital from ICU just 15 days back, and I am a COVID survivor. Okay, so I have a question. Hello.
Yes, I can hear you. Yes.
I have a question that if a person get infected just before first vaccination, get infected means he doesn't know whether virus has entered or not, as the incubation period is 5 to 10 days. So if a person infected, really virus entered in the body, but he doesn't know, and after 2 to 3 days he got vaccinated and symptoms appears after 4 days of first vaccination, in that case, the cytokine storm will be more or severity of infection will be more?
So let me tell you this, that why are we giving the vaccine? We are giving the vaccine in the small form of antigen to trigger the antibody response. So cytokine storms are directly related to the kind of, I would say there is, at this point of time, there is no published data to kind of comment that if vaccines are given to infected patients, that triggers more cytokine storm currently. So hypothetically, if I say, if the question you are asking is that the person has got infection and he receives the vaccine at that point of time, what happens to that person? That person will be, that the virus is going to be, if the viral load is more or the virus is going to infect the person, hypothetically speaking, the antigen antibody response will be more in that person with comparison to a person who's not received the vaccine, because the trigger has already been initiated by the vaccine. But whether it will result in a cytokine storm or not, this is still not known. And I don't think so I'll be able to answer this. This is not known. This is under research. This, I think, requires more information.
Yeah, because in my case that happened actually.
Oh, okay, okay.
Okay. My next question, just I'm curious to know that we are taking this first dose, and after recovery you will get the second dose of Covishield. That second dose is booster dose, or we have to take this vaccine every year? As you know, vaccines is mutating every time, and a lot of variants are found. So companies needs to modify that vaccine as influenza vaccine is done.
Correct.
So do you think we have to take this vaccine every year, or is there any booster dose?
So that is a good question. And let me tell you that already the booster dose studies have begun in the world. And OV Boost study has begun in the United Kingdom, where the government of UK has started the study with all kinds of vaccine, not only Covishield, where they have appealed to anybody who has received 2 doses to come and receive their booster dose. And the results are expected somewhere in October of that study. The Covaxin clinical trial, which is ongoing in India, is studying the booster dose effect as well. So after 2 doses, after 6 months, a booster dose has been given in selected centers in the country, and the booster dosage are being studied with the immunogenicity for the immunogenicity response. So currently, until those data arrive, we will have to stick to the Indian government guidelines where only 2 doses will be required. But as influenza virus, which is a close relative of coronavirus, and it changes its, modifies itself through mutation, and we have seen that every year we need a vaccine. This is my personal opinion that COVID-19 will also walk on the same path, and we will have to modify, update our vaccines, and we will have to take every year a booster dose. Of course, I await for more published data and the government guidelines to frame in due course of time.
So, Dr. Bhowmik, what is your take about the vaccination in pregnant mother and lactating mother?
It should be done. It should be done because now we are seeing that in case of pregnant mothers, they are getting infected. Some of them are unfortunately dying, and also after pregnancy, if they are getting infected, it is not creating a lot of problem for the children. Children are being born with antibodies. Sometimes children are being born with the infection. So, as per the government guidelines, the pregnant mothers should receive the vaccine. And for lactating mothers, again, we have to understand they are a vulnerable group. They are a susceptible group for infection. So the government guidelines and last month have changed, and they have asked the lactating mothers to take the injection of vaccine as well. So they should take the vaccine because, again, Dr. Hussain, you understand, being a pharmacologist, that the benefit risk ratio is analyzed. So the benefit of giving the vaccine in this vulnerable group is much more than the risk of dying from the infection if unfortunately if these mothers get infected.
Absolutely. Thank you, Dr. Bhowmik. Thank you so much.
I'll just add one thing, Subhrojyoti.
Yes,
the
sir.
last NAGVAC recommendations have still not recommended it in pregnant women.
Okay, sir.
But Foxy has given a recommendation there. So they have said that the moment a baby is delivered, the first dose of vaccine can be given. For lactating women, everybody should be vaccinated. For pregnancy, the NAGVAC has not given a yes till now. So that's in next meeting, possibly the end of this month, and maybe then they'll review the data.
Right, sir. I was just mentioning the Ministry of Health and Family Welfare thing that they have now recommended the vaccine for pregnant women. So our government is now recommending. Professor
Sir, we have
Dasgupta.
next from Ranjita sir.
Okay, okay. Okay, go ahead,
Hi,
please.
Dr. Bhowmik, thank you. I think it was a lovely webinar and very informative.
Thank you.
I just want to say that mid-April, I was diagnosed with COVID. And obviously, I've recovered now, but I've been suffering from a lot of after effects. And I believe that my legs, my calves have been paining, and I've been having blackouts. Though I did go through a lot of prescribed medication, which was, I think, multivitamins, and I think there was nothing really. The doctor even said that everyone has a different diagnosis, but I think I'm still not okay. I don't feel okay. Do you recommend any tests, or do you recommend I undergo any kind of different medication?
So I think this is absolutely a one-on-one discussion we should do on basis of your history, and because it's very difficult without knowing your proper medical history, what medications you are taking. I would request you to get in touch with me personally, because it's not right to discuss on a public platform. But I will definitely tell you that some of the patients post-COVID, there is a pro-coagulant state. That means they can develop coagulation disorder, and some of the deep vein thrombosis cases have been reported. So it is always better to get yourself checked whether you are developing, because the site you are mentioning, the calf muscles paining, they're one of the commonest site for developing any kind of deep vein thrombosis. So I would request you, Ranjita, that if you don't mind, you can get in touch with me on a one-on-one basis, because there are certain history which I would like to elicit, which I don't think is proper for patient confidentiality to discuss on a public platform.
No, surely, Dr. Bhowmik. I mean, that would be great. Thank you so much. How do I get in touch? Do you have an
So
email ID?
you can get in touch with me on my email ID, which is drsubhro.
I'll just note it down. Just a
Yes,
second, please. DR.
SU.
Yes.
BHRO. B as in Bombay, Hyderabad, Russia, Oscar
Right.
@gmail.com.
Right. I've just noted it.
Yeah, please. I think you will understand, because of patient confidentiality issues, I will not be able to discuss this on
No,
this public platform.
I can totally understand. I'm grateful. Thank you so much.
Yeah.
Thank you so much for your time.
You're welcome. Professor Dasgupta, আমরা কি আরো কন্টিনিউ করছি?
I think already we have crossed 12:40. So I think for doctors, actually, especially the time is also very valuable.
Yes, sir. I think Professor
have
Chakraborty is also very busy person. So we will
responsibility, to serve the I mean,
so we can.
So that's we can sum up. I think with Dr. Pranta Chakraborty, and afterwards we can totally sum up with our honorable Vice Chancellor's I think speech. But at least let me tell you that tell you all the viewers that we will share the email ID of Dr. Subhrojyoti Bhowmik. So you please redirect your questions to that email ID, so that you can directly access. And I think Dr. Bhowmik will take time to answer those things in his own convenient way. Okay, I think that would be better. So what actually, Dr. Pranta Chakraborty, what is your advice in this?
Thank you, sir. Thank you, sir.
Yeah. So I would like to thank Subhrojyoti, okay, because we have been trying to make people understand what the truth is, and science brings you closer to the truth. So I think whatever questions people have, we use a term for that is vaccine hesitancy, right? And so he gave the brilliant example that when you are hungry, would you prefer having your bhat mach, or would you prefer having biryani? The other thing people should realize is that we belong to a generation when we have eradicated polio, we have eradicated smallpox. And if I ask any of you, do you know which company's vaccine you took? So that is not an important question. The question is what you will achieve by taking a vaccine, which has been brilliantly described by Subhrojyoti. If you still have any hesitancy, remember that you can always read up from authentic sites like Ministry of Health, Government of West Bengal, Ministry of Health and Family Welfare, Government of India, even CDC, NIH, WHO. But please don't try to do something which is not substantiated by science. This is my sincere request, because throughout this pandemic, we have realized that teaching science, so-called being educated in science, and thinking scientifically are now divergent things. So thinking in a scientific manner is more important. Go by that. And if you have ever any queries, Shubhro's email has been given. You can always contact him. Thank you, Subhrojyoti, again, and thank you, Macaut, for organizing this.
Thank you, sir. And now I come back
Thank
to
you, sir.
our Honorable Vice Chancellor to say the final concluding words, and so that we can close down today's event. The sir is there, or I think
Yes,
Sir,
we had enough discussion, and if there is a demand further, then we can organize these types of lecture, this in our this next session further, inviting Dr. Bhowmik or Dr. Chakraborty again. So I think this was really required, and we believe that by this webinar we could this clear some of the doubts prevailing in the minds of common people, even these educated people. So let us stick to our endeavors in propagating scientific thoughts and logical thoughts among the minds of common masses, leaving behind all these these preconceived notions or ideas which are not validated by any this scientific experiments and logic. So with this, I would like to thank Dr. Bhowmik, Subhrojyoti Bhowmik, and Dr. Chakraborty for coming to this digital platform, for sharing their experiences and observations in this particular area. And we will be meeting again. As I see that there were lots of enthusiasms amongst the participants, and numbers of questions large numbers of questions were there. So maybe after this 15 days or 20 days, we can again assemble for organizing another type of meeting, because we are really concerned about this third wave, so-called third waves. There is again difference in opinion. Some people are talking about this development of herd immunity, and nothing will happen to this country. But again, some people are skeptical about this vulnerability of our young populations to this third wave. So let us have a discussion in this matter. This maybe after 15-20 days. So till that period, goodbye and see you again.